we're jumping straight into the health check with Dr. Bhagat. And today we are talking how to be a good, what does it take, to be a good patient? This one is for you. It is for you, the listener, definitely. Let's hear what the doctor likes and what he doesn't like. Good morning, Dr. V.
Good morning. How are you, Zoo?
I'm great. How are you this morning?
It's an amazing slide into winter. It's a sort of a rapid precipitation into rain and fog and really icy cold. So I'm good. I hope everybody out there is wrapped up warm and some of them have taken their flu shots. So be careful. Remember, simple things, although it's not the topic of today. Don't take antibiotics until you really have to. Antibiotics don't help with flu. The common cold is the common cold, and everybody gets it. Don't be afraid by sniffling. And if you are at risk, take the influenza vaccine. It's the only thing that's been shown to prevent flu. So that's important stuff in terms of the winter. Today we're actually going to be talking about something that's really close to my heart. As a pharmacologist, I like to talk about what it is to be a good patient. And
yes.
In essence, I find that patients are really petrified when they go and see a doctor. And really, we're not in 1920, we're in 2022. And so you really need to, we always teach our medical students, you need to try and empower patients to be more confident in terms of asking questions. And a good patient, no matter how much you annoy your doctor, and if the doctor really gets annoyed, change your doctor, is to really ask questions. And today we're going to be talking about, rational prescribing, the principles of drug selection, because too often I find still, you ask a patient, what are you taking? And they'll say, oh, it's a purple pill. And you'll ask them, what is the strength? And they'll say, I don't know. And you'll ask, what's the name? I don't know, Naka. A lot of people are taking 3 or 4 different drugs and they can't remember them. They'll say one's a round tablet, the other one's a square tablet. And this is really not good for people out there today, because it's really, really vital that you understand
what you're taking,
why you're taking it, and how you're taking it. And the things that patients need to know about their medicines. I mean, common things. The first and most important thing is ask the doctor, why am I taking this medicine? This will provide justification for the patient adhering to the treatment regime. Because often what happens is if the doctor doesn't explain, you need to take this medicine because it'll prevent stroke, people will go on what we call as doctors a drug holiday. They'll say, today I think I'll take a weekend break from my aspirin or my blood pressure pill, etc. And they land up in trouble because they don't realize the relevance of this thing. And then the second thing that I always tell students to tell patients is how the medicine works. Many patients actually will be interested in how a medicine works, and this provides additional justification and confidence in patients taking medication. There's an adage, Zoo, that we teach students that is called a 30% rule, where 30% of patients take 30% of the drugs 30% of the time. And it's really true. If you ask yourself, if you've been prescribed an antibiotic or something else, how many times do you think, well, I've taken enough now, I feel better, or I'll skip today, or instead of taking it 3 times a day, I think I'll take it only once a day. We all do that. Even doctors do that.
Very guilty.
And it results in lots of issues. It's a really important thing. The third thing to say is if you're taking medicine, supplements, or anything else, ask how do you take this medicine. This may be important for maximizing the effectiveness. For example, do you take it before meals or after meals? If you've got heartburn, do you take the pill before you take a meal or after the meal? If you have a blood pressure pill, is it best to take it in the morning or in the evening? If you're taking aspirin, do you take it with a meal or an empty stomach? Because these are chemicals that are absorbed in the gut, and depending on the state of play in the gut, whether you've eaten, whether you've taken alcohol, whether you've drunk a lot of Coke, whether you've taken fizzy drinks, and then you pop a blood pressure pill, it may not work. So sometimes the medicine is not working because you're taking it at the wrong time. So ask, how do you take this medicine? And last but not least, in terms of the benefits, ask what am I to expect from this treatment? This will help to affirm the benefits of again, continuing, adhering to the treatment. Because if people say, I don't feel any better, Naka, you have to explain, for example, a blood pressure pill will drop your blood pressure, but you may not feel much different because blood pressure is largely silent. And so the same with sugar diabetes. Until it's really high, you won't notice that the sugar is particularly high. So you've got to monitor and measure so that people and patients say, look, we can tell them, your cholesterol's dropped by 35%. Otherwise, people will just, again, the issue is what we call non-compliance or non-adherence. People, often is the time where I'll see Gogo's coming to my office and half the box is empty and some of them are full, and you realize that what she's doing, she's just picking what shall I take today, So particularly grannies and old madalas, they're famous for doing their own thing, and then often you find... Yeah, we all have grannies at home, and then you find that, that they'll just decide today, I'm not taking this pill, I'll rather take, I don't know, some carrot juice or something, and you end up wondering, why is the blood pressure not well controlled? And what happens if you're not a good doctor is you just keep piling more and more medication, and they actually take less and less of it because they think, this is just too much for me. So it really is important in terms of being a good patient is to insist on explanations. Why is it working? How is it working? What time of the day should I take it? What are the benefits to expect? And these are really important questions for our public out there.
Of course. And I see here, what are the don'ts of consultation? Like in consultation rooms, would you rather not deal with from a patient, or what kind of advice would you give somebody not to do inside the consultation? Hey, Skua.
What not to do in a doctor's consultation is to say yes all the time, erra, emma. If you just keep nodding and saying to the doctor yes, 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 without actually understanding, you will leave. Often is a time, Zoo, still today, unfortunately, where when we do rounds in the hospital with the whole team, when we leave as doctors, the patient will ask the nurse, what did the doctor say? Because the patient is petrified and won't ask the doctor and will say yes to everything, not having understood anything. And then when everybody's gone, they'll call the nurse back to say, explain to me in simple terms, what did the doctor say? Because doctors have a bad habit of using jargon. So,
yes, and we won't understand, Yes,
if somebody has chest pain, they say, well, you just got neuritis. And you'll say, yes, doctor, not understanding what the word means. It just simply means that there's inflammation of the nerves. But if you don't, you've got to be, like we say in the classroom, don't be afraid to ask a question, because there are many others who want to ask the same question, but they're too embarrassed. And it's the same thing. So don't be a yes woman or yes man in the doctor's room. Because, when it comes to drugs, you want to know, for example, the adverse effects. What common adverse effects if I take this blood pressure pill, or if I take this cholesterol pill, if I take these ARVs, or if I take the COVID vaccine, what are the common side effects? What are the serious side effects? And the precautions that can improve symptoms. For example, improve safety, rather. How do I monitor the adverse effects? Am I going to get a skin rash? Am I going to bleed? What if I see bruising on my skin? What does it mean? People sometimes are not aware that the tablets shouldn't be kept in the sun, because sun exposure may actually degrade the tablets. So don't leave it in a hot area. So these are things that are important. And also, when do I come back and see you, Naka? When do I
follow-up questions?
Because often people will take a treatment, not go back to the doctor, and so they don't get any feedback as to how and what the things are doing. So it's really important to ask, particularly with drugs, which you're talking about today, what is the drug? What is the dose? How am I going to take this thing? How frequently do I take it? What happens if I miss the tablet? What are the side effects? If I'm taking other tablets, doctor, how will they interfere? There's so many things. If there's a family history, Zoo, of peanut allergy, some of these tablets may have been manufactured in a factory that contains peanuts.
Yes.
If you are a smoker and also an asthmatic, is the inhaler going to work at all? Is there genetic history of, breast cancer? Should I be doing something about prevention and screening, which we're going to talk about next week? So there are lots of things that make you a good patient, because the doctor will feel that you've understood them, and that you will actually then also impress the doctor by saying, look, I'm taking this twice a day. I skip this on occasion because I get these side effects. Can you help me? So you must be interactive with your doctor, because it's really vital. And I keep saying, Zoo, that if the doctor says, often in the old days, doctor would say to you, well, I'm the doctor, you're the patient, just do what I tell you. This is not on, and and often I've seen still with some of our older colleagues, before the patient is actually sat down, the doctor's already writing a prescription.
A prescription, yes.
You know, so this is, 21st century, we need to change the way we think. It's not across the table where the patient is sitting in front of you. It's side by side as a partnership, because it's the only way today in the complexity of our world, what with COVID and now, I believe, monkeypox or something.
Yes, I don't know where that's creeping from, Dr. B. But yes, with all these things that are coming up, we really need to unite and help each other.
We do, because it results in your betterment. We want improvement, Zoo, in our health span as well as our lifespan. So that's important in terms of all the medicines we take. And the supplements. One last thing before we go, Zoo, is often you need to tell the doctor what supplements you may be taking or what traditional medicines you may be taking. You may be taking Chinese teas, you may be taking, moringas, or you may be taking something that your granny made up. You may be taking sniff or snuff, as some people say, and you won't tell the doctor, and the doctor will keep wondering, why is this medicine not working fully? Because it may be interacting with the green tea or the moringa or some other concoction that you're taking at home. And there may be nothing wrong with the concoction, but the doctor needs to be aware that these things are being taken. So don't be afraid to say, by the way, doctor, I also take all these other supplements, which, I buy from my naturopath or whatever. So that's really important, too.
Definitely. Well, I'm obviously looking forward to catching up and talking to you more about the screening. And I do have to let you go. Dr. B, thank you so much.
Thank you. Take care.
Have a great week, eh?
Thank you.
Bye, Dr. B.